Hello, my name is Jessica. I'm going to be doing a head, eyes, ears, nose, and throat exam on you today.
Okay.
At this point, I've already examined the patient with his name and date of birth. I've washed my hands, so I'm just going to put some gloves on. And then I'm going to start by examining his head. So his head is normal cephalic and atraumatic. I'm going to touch your hair. Your hair is of normal texture and evenly distributed. I'm going to touch your scalp. There's no lumps or lesions noted. I'm going to ask if you could remove your mask, please. So your face is symmetrical and the skin color is normal for ethnicity. So you can put your mask back on. I'm going to assess your eyes now.
Okay.
So the eyes and the eyelids are symmetrical. The eyebrows are symmetrical with even hair distribution. I'm going to touch underneath your eyelids. The conjunctiva is moist and pink. The sclera is white. I'm going to flash a light inside your eye, okay?
Okay.
The iris is brown. The pupils are equally round and reactive to light. And they are 2 millimeters. Now I'm going to test your visual acuity. I'm going to use the Snellen's handheld chart.
Okay.
So I'm going to stand 6 feet away from you. And then I want you to cover your right eye and read the smallest line that you can read.
L T F P H.
Okay. Uncover your right eye and cover your left eye for me. Again, read the smallest line that you can read.
L T F P H.
Okay. Uncover your eye and with both eyes open, read the smallest line that you can read.
L T F P H.
Okay, very good. Next, I'm going to test your extraocular movements. So I want you to just follow my finger with your eyes. Okay? So you're going to do to the left, to your right, I'm sorry, up and right, up and left, left, down and left, down and right. Okay, no abnormal findings. Next, I'm going to test your visual fields. So I'm going to ask that you tell me the sum of the total number of fingers that I'm holding up while you look at my nose.
Okay.
Okay? So we're going to do with both eyes open.
Okay.
Okay?
4, 4, 4, 4, 4.
Okay, very good. Now cover your right eye for me. Okay, we're going to do the same thing.
Okay. 2, 2, 2, 2.
Okay, now uncover your right eye and cover your left eye. And we're going to do the same thing.
Okay. 2, 2, 2, 2.
Very good. No abnormal findings. Next, you can uncover your eye. Next, we're going to test for convergence. So I'm going to ask that you just follow my finger with your eyes. Okay?
Okay.
Very good. And I'm just looking for pupil constriction. Okay? Which is your pupil's constricted. And next, I would, with an ophthalmoscope, if I had an ophthalmoscope, I would assess the fundus of his eyes, which is the inside part of his eye. Normally, what I would do is I turn it on, put the diopter at 0, use my right hand and my right eye to assess his right eye, my left hand and my left eye to assess his left eye. And you would hold it slanted at a 20-degree angle, about 15 inches away from him. And I'd have the patient look up over my shoulder towards the wall. And then I would shine the light in his pupil, and I would look for the red reflex, which indicates that I'm looking at the retina. And then I would adjust and focus the ophthalmoscope by using the diopter, and I would look for the optic disc, which is a round structure. It's red, it's orange and yellow in color. And then I would look at the retina and assess the veins and the arteries.
Okay.
And after that, then I would assess your ears. So I'm just going to look at the external part of your ears. The ears are symmetrical. There's no scars, no lesions noted. Then I would pull the auricle up, back, and out, and I would use an otoscope to assess the ear canal and the tympanic membrane. And the tympanic membrane should be a pearly gray color. I would assess for any redness or any bulging. I would also look for the cone of light. In the right ear, it should be at a 5 o'clock position, and the left ear, it should be at about a 7 o'clock position. And now I'm going to assess your hearing. So I'm going to stand behind you about an arm's length, and I'm going to tell you a sequence of letters and numbers, and I'm going to ask you to repeat them after me. Okay?
Okay.
We're gonna test the hearing in your right ear first. So I want you to, with your pointer finger, to touch your tragus right here in a circular motion while I do the assessment.
Okay.
Okay? So I'm gonna stand at an arm's length. 4A2.
4A2.
Okay, very good. So you can stop doing that. And now I want you to do the same to your right ear. With your pointer finger, rub in a circular motion over your tragus, and repeat the sequence of letters and words after me, okay?
Okay.
2A4.
2A4.
Very good. Okay. And next we're going to do the Renee test. So that's going to compare air conduction versus bone conduction. So what's going to happen is you're going to hear like a vibration sound. And I'm going to put this on your mastoid bone right behind your ear. And then I want you to tell me when you can no longer hear the vibration.
Okay.
And then I'm going to put it in front of your ear. And I want you to tell me again when you can no longer hear.
Okay.
Okay?
I can no longer hear the vibration.
Okay.
I can no longer hear the vibration.
Okay. Now we're going to do the same in this ear. Okay?
Okay. I can no longer hear the vibration. I can no longer hear the vibration.
Okay. So we just tested air conduction versus bone conduction. And air conduction is normally twice as long as bone conduction and should be about the same for both ear, which it is. So now we're going to test, it's called the Weber test. And I'm going to put this on your head, midline, and I want you to tell me if you hear the vibration more on the right, on the left, or if it's equal. Okay?
Okay. I would say it's about equal.
Okay. Very good. It should be equal. Alrighty. And next, we're going to assess your nose and your throat, your mouth and your throat. So you can remove your mask now. just assessing the external part of his nose. There's no deviation noted, there's no scars, no lesions. Then I would use a speculum to look inside his nose. I'm going to use my pen light. I'm just going to flash the light, okay?
Mm-hmm.
There's no swelling, there's no rhinorrhea noted. Okay. And next I'm going to assess your sinuses. So I'm going to touch your frontal sinuses right here.
Okay.
And then your maxillary sinuses right here, okay? And I want you to tell me if you feel any pain.
Okay.
So frontal. Any pain?
No.
And maxillary. Any pain?
No, ma'am.
Okay. So no tenderness upon palpation. And next is going to be your mouth. So I'm just taking a look. His lips are pink. Can you open your mouth for me?
Mm-hmm.
Okay, the oral mucosa is moist and pink. His gums are pink. They're not inflamed. His dentition is good. And then I'm going to take a look at your tongue. Let me see. Can you stick your tongue out for me?
Yeah.
Okay, very good. I'm also looking at the roof of his mouth. Can you stick your tongue up? Okay, I'm looking at the floor of the mouth. There's no lesions. And can you stick your tongue to the right and left? Okay, very good. Other side. Good. I was just looking at the lateral parts of your tongue. And let me see. I'm going to look at the back of your throat, okay? So
Okay.
Can you open your mouth for me? I'm going to press on your tongue. Okay, so the uvula. So can you say ah, please? Okay, very good. The uvula and the soft palate rise symmetrically. I'm going to test your gag reflex. Okay, very good. Alright, and that concludes the head, eyes, ears, nose, and throat examination.